Welcome to the Bone and Joint Playbook with Dr. John Urse, where we explore an extensive range of orthopedic topics and insights. Our goal is to help you understand the available orthopedic options and treatments available, and hopefully give you some answers to questions you might have. We want to thank our following sponsors.
Ted's Authentic Greek Salad Dressing and Marinade. It's healthy, gluten-free, and delicious. You can find Ted's in Dayton, Ohio at Dorothy Lane Markets, Health Foods Unlimited, and Dots Markets. That's Ted's Authentic Greek Dressing and Marinade. Thanks, Ted.
We would also like to thank
Stifel's GWR Group combines more than 65 years of experience helping high net worth clients consolidate, coordinate, and simplify their wealth planning strategies. The group has access to a full suite of resources to serve all of your financial needs. Email gwrgroup@stifel.com or call 937-353-2863 to speak to Guy, Brad, or Jeff Richardson. Stifel, Nicholas & Company, Incorporated.
Hey, Dr. Urse, welcome back. This is another fun-filled episode. They're all fun-filled, by the way.
Of course they are.
Fun-filled episode of the Bone and Joint Playbook with Dr. John Urse.
How you doing today, Terry?
Dr. John, it's going to be like 82 degrees out. It's early April. I got to get out of this basement and go do something fun.
You can caddy for me today. I'm going to be golfing.
Where are you golfing at?
Over at NCR.
Oh, look at you, you fancy guy.
Well, I just followed the guys that invented the cash register. Do you know that, people used to have stores for merchandise. Sure. But the people who sold the merchandise stole the money. The owners said, this is crazy. Let's have an idea to control that. Guy from Dayton, John Patterson, got the patent from somebody who invented a cash register in the late 1880s. They started NCR, the National Cash Register Company. And
Dayton,
now
Ohio.
You can keep track of what's sold in a store until the bank robbers come in and they steal it. But that's they have a golf course. That's all. Long story.
By the way, just a little bit more facts for you folks based out of Dayton. Dorothy Lane, you know why it's called Dorothy Lane?
I would guess that was the lady's name who owned the land, or the husband named it after his wife.
John Patterson's daughter was Dorothy. Yeah. She rode her horse up and down that path.
There you go.
Dorothy Lane.
John Patterson started NCR.
All right, now that we've bored these people to death with Dayton facts and fiction, so what is the topic of today?
Well, we're going to talk about therapeutic modalities, fact or fiction.
Fact or fiction, meaning some of these are just bull hockey?
Well, no, they're like anything you hear. You're going to hear a lot of ways to take care of problems. Therapeutic modalities would involve things that you put on for a sore shoulder, like a topical ointment. Yeah. There'll be topical applications.
Icy hot, things like that.
Yeah, maybe patches, creams, ointments. We're going to talk about which ones we think help, and we'll rate them from 1 to 10 on what I think effectiveness
10 being good.
10 is good, sure. And then we're going to talk about some of the physical therapy modalities. So we go to physical therapy. Our doctor or healthcare provider tells the therapist, you've sprained your knee, you wrenched it playing soccer.
Right.
And then they're going to say, well, you need an ultrasound or some deep tissue massage. So there'll be manual medicine, some of the physical therapy modalities like myofascial release, traction. We'll talk a little bit about manipulation, massage, maybe some chiropractic and osteopathic manipulation.
Are you going to hit the acupuncture at all?
Yeah, all these are modalities to control your therapeutic problem, right? What are you going to do for your problem? And there's a lot of them. Some of them involve light therapy. We'll talk about infrared light, near and far infrared. We're going to talk a little bit about ways to get things into the tissues deeper or not, depending where the problem is.
Okay.
And so these modalities are just all over the place. So when I tell people, how do you analyze these, or do you approve of them or decide to do them or not, you should look at it like any bit of evidence in the medical field. There's proven entities. You have a blocked artery in your heart. They open it up with a stent, and the blood flows. That's proven to be good for your heart. It's proven.
Right.
Promising means it's really potentially a good modality. Things like blood flow restriction therapy. They put a tourniquet on your leg, and it restricts the blood flow to the leg. So when you're exercising, it literally improves muscle strength and size and faster recovery. So there's newer modalities that are promising. Promising means more research needs to be done.
Right.
But we think we should keep looking at it because it looks encouraging. I'm going to give that BFR, the blood flow restriction treatment, a high number because it's new, but it's promising. Then there's things that are fuzzy, things that don't, you're not really sure. I've heard, red light therapy. We put the mask on, they have it on TV, and the lady sits there and comes out looking like Cleopatra. Well, maybe she does. Depends how much you spend, but that's a little fuzzy. Then there's things called noise where you're just hearing stuff at the golf course or the beauty shop, or like you are putting motor oil on your thumb from your garage, and that's like noise. I mean, you're not even sure that anybody's even looked at that, like, let alone done a study on it. And then there's nonsense. Nonsense is the last category. That means if you chew bubble gum, you'll be able to do algebra questions better. Now, what do you think of that?
That's probably nonsense.
That's probably nonsense.
Yeah.
So when you look at things, we talk about all these things today. There might be 10 or 15 things we talk about. I'm going to give you a 1 to 10 scale, but they kind of fall into a bucket of this is a proven entity. We know that ice on a swollen ankle is good. It cuts down inflammation. It helps your pain. You just got hit with a baseball thrown to 89 miles an hour on your forearm. Put some ice on it. That's like a proven entity. So there are things that'll be common sense, and there'll be things that they may work, and there are things maybe I don't know, but I'll tell you what I know about it and what my 40 years of ortho has
all right.
given me feedback for.
We want to keep this to a reasonable amount of time, so let's get into this and where we start.
Well, we always start from outside in. So let's start with what are called topical treatments. So you've heard of some of these things called Novocaine patches. You put them on a sore area. Some of them are, they have. I'm waiting for more sponsors. So if Icy Hot wants to get involved with my podcast, feel free to. But
reach out to us.
There are things called Lidoderm. There are things called Salonpas. Different types of numbing patches. So we've all gone to the dentist and gotten Novocaine to numb our lips before they work on our teeth or gums. And that numbing medicine is in these patches. So it provides about a 10 to 12 hour relief to an area that hurts, but it doesn't really get very deep. So if you've got, let's say, hip bursitis that's pretty deep in your hips, and it depends how hippie you are on the waist, how much, soft tissue is between the skin and your bone, that patch isn't really getting all the way down to the bursa. So it's okay for maybe an area that's sunburned or bruised, but a patch isn't always going to penetrate very far. It's fairly benign. I'd give a numbing patch a 4 out of 10.
4 out of 10.
If you take then ointments, you take these creams. You take, like, Voltaren is a common anti-inflammatory. It's called Voltaren gel, but there are other types of anti-inflammatory gels. You rub them on, and some of them are capsaicin. You've heard of some of these pepper extracts. You rub them on your thumb. Certainly when your thumb is closer to the skin, like the actual bone and the small joint at the base of the thumb, where a lot of women have pain at the base of their thumb, an ointment is going to get to the joint a lot easier because it's closer, right? So the penetration may be better. You've heard there are things called frankincense, different types of, it's an extract from boswellia, one of the herbal remedies we've talked about. There are CBD creams, some of the marijuana extracts that CBD doesn't have as much pain relieving benefit as THC does, and that's a whole nother topic we'll do one day on medical marijuana.
Yeah.
But the CBD creams are out there. You can go to some dispensary and spend a lot more money than you need to. I'd give the CBD creams about a 3 or 4 in my list. But if you want to spend a bunch of money and feel better, these will not make you high or crazy. It doesn't have the mind-altering portion. It's more the some of the pain-relieving modalities, but they're weak, I think, at best when they're rubbed on a topical application.
So would a bruised arm, like you said, you got hit with a baseball, would a cream work on that because the bruise is on the surface?
I think an ice pack's the best thing, but then, a cream later. Always use ice for swelling and inflammation. And then the other things that go on skin are things that would be blocking pain coming from that. So you may, you've heard of some of these things that are like it's called a TENS unit, which is a transcutaneous nerve stimulator. So these little patches have wires. They go to a little battery pack. And let's say you have burning pain coming from an inflamed nerve in your foot or hand. Yeah. And a TENS unit could be placed by your therapist, and they would then block the pain fibers coming up to the spine where we sense pain. So a TENS unit is a a skin modality that a therapist may use to decrease your pain from an area. They put them on your back, they put them on your legs, arms.
Is that called a nerve block, or is that something different?
No. We're not blocking nerves going down. A
Okay.
nerve block is when you say, "Well, I've got to take your infected nail off, and I'm going to pull it off, but it's going to hurt. Let me numb up that nerve." A nerve block puts numbing medicine and blocks the nerve going to the area so it doesn't hurt, just like the dentist numbs your lip.
Yeah.
When you do a TENS unit, it's called a transcutaneous electrical nerve stimulation. You're blocking the nerve, the sensing of the pain. Like when you put your hand on a hot plate, you feel hot and your body goes, "That's stupid, Terry. You're going to burn your hand." So, but if you don't have any feeling, you may just some diabetics have things called neuropathy where they don't feel things.
Sure.
They can burn. That's why you touch your bath water with your elbow before you get in, right? Especially if your feet are not feeling things. So there's things that block pain receptors. That's a thing called a TENS unit. And your therapist might use that. There are things that actually help stimulate a muscle to contract called a MENS unit. So like a men's room, not a bathroom, a muscle electrical nerve stimulator actually stimulates your thigh muscle. If I say, "Terry, your knee surgery's done great, but your thigh muscle's weak, that's why you're still limping."
Yeah.
Well, you've got to lift your leg 20 times, 5 times a day. And you say, "Sure, doc, but I'm not going to do it," because I know you're not. Then I can put this thing on your leg, and it actually sends an electric pulse to the muscle to contract it.
Okay.
And you've seen some of these ab things that you're sitting in your lazy boy and watch a football game and eat popcorn, and you're actually building your abs up with electrical stimulation. So those are all through the skin modalities that cover that area. So next we're going to get a little deeper into the deeper tissues, they call it.
By the way, I had, as you said, that a brilliant idea. You've heard of 30-minute abs, right?
Oh, yeah, 5-minute abs.
Let's do 5-minute abs.
That's right.
We're going to beat the market on that one.
Well, that's a good idea. Yeah, that you could put that in a movie if you haven't seen that. All right, so let's go into what would a physical therapist tell you is a modality that might help your, say, tennis elbow. And most people who get pain in their elbow, it's from repetitive things, not always tennis or golf. It can be from hammering a roof.
Oh, by the way, go back. What do you give you the tangent things? What rating?
Oh, the TENS units?
Yeah.
Oh, a TENS units is probably a 5 or 6.
Oh.
Yeah, they work.
Okay.
They have to be put in the right places. You have to have these little frequencies adjusted. Your therapist would do that. But yeah, and the muscle stim units are good. Some of them are covered, some are not by insurances, but there's certainly something worth looking at.
All right, physical.
They're very benign. None of these are going to cause problems. You would always check electrical things with your cardiologist if you had a pacemaker or some other thing that goes tick tock in you, right? So then if you go to deeper things, so we now have tennis elbow. It's not the skin. It's really my lifting things. I can't even hold a pencil. I've been using my mouse too much, playing solitaire, whatever you're doing to irritate a deeper body part. So tendinitis, inflammation of a bursa, something deeper down that you've now sought medical care for. So your therapist may do some what's called fascial release. Myofascial release means it's like kneading bread with your thumb. They're actually working out some of the spasm in the muscle. They're stretching or doing deeper releases of the fascia. The fascia is a lining over muscles, and it becomes contracted or tight when it's not stretched properly or if there's been injury to the area or a surgery. So there's things that help restore normal muscle strength or muscle length that work out some of the benefits. But when you say, "Gosh, I've gone to massage therapists before and I feel great for a day or two, but then I'm kind of sore again." Well, they're really temporary. So the benefit is really high short term. They feel good, you're relaxed, they play nice music, you finally turn off your phone and you just chill for an hour based on how much you can afford to pay a massage therapist.
Yeah.
And then, really the long-term effects aren't there because you're going to go back to doing all the stupid things you've done to get there in the first place.
Is that the same thing with physical therapy?
No, physical therapy is different. Massage therapy is, you could go to a Hilton hotel on vacation and say, "Do you have a spa?" And they go, "Sure. Do you want a massage?" And of course, they'll charge you 3 times the normal amount because you're at a spa, right? But they then put on nice music. You take a nice warm shower to loosen up. You lay there, and they massage your tissue. And there's different types of massage. There's deep tissue massage. There's stretching massage. There's Swedish massage. There's Rolfing, where they take your elbow and really knead it. But it's just that's just a modality that is it's useful. It's very well accepted around the world. People get massages either by private companies, by some of the spas offer that, and it's all part of some physical therapy modalities where you have an injury, where you have your physical therapist may do what's called a myofascial release or a deep tissue release. That would also include things we talked about, chiropractic or osteopathic manipulative therapy. There are things that adjust things that are out of whack. If you twist your ankle, you've twisted your leg. There's people that feel you should untwist it. It's affected maybe the upper leg, even though you twisted the ankle. Everything's a bit like a teeter-totter, right? One end goes down, the other goes up. Our pelvis can be out of whack. There are times what's called your SI joint. We had a podcast on sacroiliac problems.
Yeah, sure.
And it's, as doctors learn medicine, MDs learn medicine, treatment modalities, disease improvement, right? Osteopathic medicine involves learning the medical part, but also manual medicine.
Are those DOs?
DOs learn manual medicine and regular medicine. So they're really learning some ways to adjust some musculoskeletal things that is part of like a headache. If you have a way you can relieve headache with some gentle traction or some manual medicine techniques, those are good because they're avoiding medicines. They're helping a problem. And there are people that are very talented at that, okay? Some chiropractors are. I'm not talking about like cracking your neck and, doing different things. Some of those things are useful. Some of those have to be tempered a little in certain age groups and bone quality conditions.
Yeah.
But artificial joints, things like that. But in general, all the types of deep tissue treatments can be administered by therapists, massage therapists who aren't physical therapists, doctors, chiropractors, whoever you choose to help you. It could be your trainer on your sports team. Not everything goes to an orthopedic surgeon the first time you twist your ankle, right?
Sure.
You're going to be on the field. The trainer comes out. He looks at it. You go over to the blue tent. You get an evaluation, and you probably get your ankle taped and put some ice on it, and you get in a cold bath at the end of the day, at the end of the game. So everything follows a simple to more complex treatment path, because if simple things help you, you don't have to go spend $900 to tape your knee. So let's talk about
but before you go, what are you rating physical therapy and massages and things like that?
I think physical therapy is different than massage.
Okay,
physical
give me a
therapy
rating on that.
modalities, I think, are an 8 or 9.
Wow.
For just about everything. You should think of therapy as a way to learn what to do and more importantly, what not to do for your problem.
Okay.
Because if you want it to get better, if you we had a thing on hamstring injuries. So when you stretch your hamstring muscle behind your leg because you were trying to steal second base, the worst thing you could do is stretch it more, because now you're ripping the muscle more. It's bleeding more and it hurts it more and you're doing more damage. So therapy can tell you, hey, don't do this. Let's do that. Let's quiet things down. Let's get compression. Let's control it. So therapy is really useful. And people say, well, I have to pay for therapy. It's like, well, go once or twice, pay your copay, and figure out what to do at the gym for your problem. You may want to work it out yourself, but it's really useful to know the right thing to do.
Massage, 8 or 9, 10, 4
I
or
think
5?
massages are like a 7. I like them. They just
Do you like them, but are they giving you value?
Oh, sure. They feel great. The problem is they don't last very long. Like I said, after a day or two, you're like, well, I'm back, working in the garden, and my back is sore, and I might need another massage next week. Well, that's how many of those you can afford a month, right? Some people go once a month, some people go once a year, some people do it when they're in San Diego at a spa resort, and until they see the price, and then they never go back.
So what's the next one on the list?
Well, the next one should be, let's talk about what's called K-taping or sports tape. You've seen all these little different colored stripes and bands that are on shoulders, knees.
Or football players and things like that.
Yeah, and tennis players. And you'll see, and what those are, it's called kinesio tape or K-tape, mercifully, right? Anything that can be abbreviated, we like to do that. And so a K-tape, what it does, it helps, like if your kneecap is tilted, we talked about front knee pain, and when your kneecap sits in like a little groove in the end of the thigh bone, if it's not sitting like two spoons in a drawer, it can tilt, and then it rubs the cartilage, which causes the front of the knee to hurt.
Yeah.
Well, K-tape can tape that and line the kneecap up better, and that stays on for 2 or 3 days. Your therapist puts it on, unless you go on YouTube and figure out how to do it yourself, and you can do that. And it's probably not deeply evident in our literature about how wonderful it is, but on a practical basis, it's pretty useful. You can do it for a hamstring tear where the tape is then brought out to keep the muscle at length so it doesn't get injured as often when you go to play. That's why you see people playing tennis with this stuff taped on their arm, or a pitcher, or a
But you can't do it by yourself at home.
It's harder to do. You can certainly do your leg by yourself, sure. I mean, it's kind of hard to do some body parts because you can't reach them.
Yeah.
You want to do it correctly, but it's a useful therapy modality. It's pretty simple. It's as simple as taking a spoon that's tilted and lining it up in your drawer so it stacks right.
But how does K-tape do that externally?
It pulls the skin over. It just tapes the knee, and it stretches the. You take 3 or 4 of these, and it's kind of like pulling a bed sheet straighter when you make your bed.
Is it duct tape? What would it be painful?
Kind of.
Would it be painful to rip off?
No, because it's more like Coban. It's a stretch tape. It's not painful to get on or off.
Okay.
It'll come off after a few days in the shower, but it usually stays for a while. It's pretty useful, worth looking at.
Okay.
I'd give it a 6 or 7.
Wow.
I mean, I think it's pretty benign. It certainly doesn't.
Have you ever tried it?
Oh, sure.
Okay.
Yeah. You play enough baseball, you get enough injuries, you're going to try a lot of things.
What else we got?
Well, we got to get probably just a little more into the weeds on a couple things that get deeper into your body. So we talked a little bit about light therapy. There's infrared, what's called far infrared and near infrared. Infrared light is really a wavelength you can't really see very well, but the near infrared is more for skin applications. The far infrared is for deeper, and it helps they think it helps circulation. It may help some deeper tissues with some soreness. It may have some other benefits that are at best fuzzy, I guess. I wouldn't give it more than maybe a 4 or 5. I think they're very operator dependent. Or if you combine that with laser therapy, there's cold lasers, there's laser therapy for inflammation around knees, tennis elbow. Those things, again, I think are operator dependent and machine dependent. So take it with a grain of salt. Not a lot of evidence on them. I still think a lot of it's fuzzy in our world. I don't think it's commonly used. But, there's always somebody opening up a laser center for health benefits.
You say 4 or 5 on the late.
Yeah, I think we don't know much. I think maybe it could nudge over to promising with more research.
Okay.
I don't think the average orthopedic surgeon knows much about it, and that's probably because it's a newer technology, just like this far infrared thing. Acupuncture, I think, is worth talking about. It's obviously practiced in different parts of the world more frequently. I think that there are very skilled people who do acupuncture therapy. There's an art to it. My concept is that it is probably useful. I'd give it a 6. I think it's operator dependent. Obviously, people that know what they're doing and understand what are called the meridians, or where pain areas are in a body. My concept for that would be, if you have a larger area of pain, acupuncture makes it a smaller area. It may not eliminate it, but it's a way to control it.
And can you briefly explain, when they're putting a needle in there at a certain spot, what is that doing?
Well, it's in theory there are pathways for nerves that conduct pain or feedback to the spine, and that's where we sense pain. That's when you know that burner on your stove is hot. You feel pain because we have a sensation of pain. Some of these things that block some of the pathways, I think it has to do with where the needles are placed and what they're done for. There are things you can put a needle in the arch of your foot, and some people think that helps your headache, because there's a what's called a meridian or a pathway to the brain from there. And there's things where parts of the foot with reflexology, which is another kind of modality that's a little bit out there. I'd call it user beware, but maybe some benefit, where there is, things under the arch of the foot that affect your gallbladder or your digestion and pressure areas. And there's some people that I think are behind that. I'd call it fuzzy, and, a 3 or 4 thing on some of these modalities. Again, someone who says, I feel better when I do it, it's pretty benign. It has no downside.
Right.
How much upside, I think, is user beware.
Wouldn't it be fun to get an acupuncture specialist to come in here? I don't even know if they're called doctors or what they're called.
Well,
I would love to talk
some
to one.
chiropractors know acupuncture. It depends if you've been trained in those areas. I think what I tell you is the last thing you may hear some of these things called stretch labs, where they actually just stretch your arm or leg.
There's one up here.
And they are available. They're not a bad thing to have. When we see physical therapy in general, or we see a doctor, there's about 5 different areas they're going to focus on. 1, reducing inflammation and pain in an area that hurts. 2, restoring movement. Well, I just had my knee replaced, but it doesn't bend very well. Well, let's try to get it to bend. How are we going to do that? Well, we're going to cut the swelling down first. We're going to maybe use ice for that, but then we're going to use some stretching modalities to get movement. Then we're going to make sure scar tissue doesn't form, so we might do some deep tissue massage or what's called myofascial release. It depends what you're trying to do, which modality they reach into the bag for.
Yeah.
And so if we summarize this, and I want to try to bring this home,
I would
bring this home with a useful to less useful list.
Yeah.
So I would say basically exercise therapy, where you're going to the gym on a regular basis and doing muscle strengthening and balancing. I call that paramount. Just think
That's
about
a 10.
Yeah, it's always a 10, because motion is lotion. We talked about that. Getting up and walking every day. It's just being outside, getting sun, doing something that keeps you off your desk and off your video games, or out of your car, or away from your desk, or sitting in a position where you're not moving, is good for you.
Okay.
And what you're doing is you're putting a future problem down the road further. So you're trying to prevent a problem as you get older by being active now. It's going to pay benefits later. So, exercise should just be part of a routine. Whatever you like to do, if you want to take a walk with your spouse, if you want to sit on a hamster track, if you like a rowing machine, if you like,
I like the hamster
whatever you do to do it, you should find that, and maybe it's pickleball, maybe it's socializing with somebody, or just going to the gym. The second thing, I think that manual therapy is really useful. I think there are things that take our bodies and put them out of whack. You shovel a driveway with a big snow. You garden. You cut trees down. You play baseball, sports. You get injured. You fall. We haven't even talked about fall prevention. Everything puts a deleterious effect on your body when you have an injury. So any manual medicine that helps that, whether it's deep tissue massage, ultrasound, there's things called iontophoresis, where they use an ultrasound to get some types of ions or modalities deeper into the tissues, like an ultrasound might do. And there's ultrasound treatments for deep bruises or deep injuries. Again, we talked about like hamstring tears or muscle contraction, spasm, traction in general. We didn't talk much about that, but if you think about traction, they can pull on the neck when you have a pinched nerve or maybe a tight muscle spasm in the neck. And there's little home traction kits that like a chin strap,
I tried
goes
that.
over a door, and it probably with 5 or 7 pounds of force can give you some relief of the spasm, and it's probably useful. In the low back, we talk about the lumbar spine, you need 300 pounds of force to pull the lumbar spine's segments apart. And it's not going to happen with traction. Right. So traction basically doesn't do much in the lumbar spine as much as it does in the neck, but it does put you in bed and bends your knees and helps your sore back get better in spite of it. So you get better anyway in 2 or 3 days because you gardened and dug too many holes for your tulips. So, what got you better may not have been the traction.
We got to come to an end here. So
we're going to go with 2 more things.
2 more things.
We
Go ahead.
love heat and ice. Okay, ice is your friend. It's the greatest thing after surgery. It cuts swelling and inflammation down.
Yeah.
Definitely have ice available. Different forms of that. Heat's useful too for different indications.
I never know when to use which.
Yeah, it's mostly ice. Sometimes muscle spasms in the back, or maybe some of the deeper bruises, a little heat sometimes. Not as common on heat.
Okay.
We talked about the electrical stim units, the massage, and your different ultrasound modalities. The key is to do anything with a benchmark. Take a look at how you do with those things, and then say, this really helped me, I'm going to keep doing it. If it didn't help, it may not work for you. The person may not have done it right. It may not even be a useful modality. You can use AI, artificial intelligence, for this. It's a great resource for looking at therapeutic modalities, which is the topic. I think they have varying of degrees of benefit. Some of these things heal with just common sense because you gave them a little time and you didn't get back too soon to gardening.
So if people want to reach out to you, how do they get a hold of you?
Well, they can look at my website, drjohnurse.com. It's got contact information for my office. It's also got reference for all these podcasts and some of the videos and resources that we have. I quit writing blog articles. They're kind of out of date now. There are resources on YouTube. The videos we do are on that. But then on the audio, you can pick it up on Spotify, Apple, iHeartRadio, any place you listen to podcasts. So we're encouraging you to support the Bone and Joint Playbook. Our sponsors, Stiefel Nicholas, the consultants with Guy, Brad, and Jeff Richardson, and of course Ted's salad dressing. It's a great Greek dressing, and we appreciate our sponsors and our tri-level recording artist extraordinaire, Terry O'Brien.
All right, folks. Well, that's it. Great episode, by the way. Learned a ton. Got it all written right here. If you have any questions, reach out to Dr. Urse. But other than that, we'll see you next time here on the Bone and Joint Playbook with Dr. John Urse. Thank you.